Hello, this is Dhaval Kumar Sheth, recording this video for the shop debridement course. Uh, First, I'm going to start with the wound measurement. I actually already took the measurement, which comes to 14.8 centimeters square in the dimension. Just to show that again, I'm measuring it at the highest length, which is 4, versus longest width, which is 3.7 centimeter. I'm not measuring this outside portion, which is considered as skin. I'm just measuring the area of the wound itself. So that total comes to 14.8 centimeters square. Now we'll start first with the shaving part of the wound debridement, and for that I'm gonna use number 10 scalpel. I could not use the pork, for the religious and particular reason, so I'm doing it on the piece of orange, and I practiced one time already, and it turned out good. So as instructed by Dr. Palmer, I'm holding the scalpel between my ring and middle finger and wrapping it around all my fingers so that it lays before, at the shaft of the scalpel and not on the blade. So alright, so to start the debridement, I'm trying to come at the angle, trying to do it at 45-degree angle. My forearm is rested on the table, and once I have a cut, making it horizontal. Again, aero part laser. Coming at the angle, making it horizontal so that I don't cut very deep on the skin. And as seen, the skin part, it's translucent.
Blurred. Yeah.
It's okay. All right. Trying to get that sawing motion so that the movement doesn't come from my elbow or shoulder and just from my wrist and fingers. That's another piece. I'll take one more piece. It's okay. That's all right. Okay. And at this moment, I'm just gonna pause the video. I'll continue this procedure, and I'll give you the end product. So, okay, so I've completed that procedure, and as you can see, I've removed the upper layer, and you can see the lighter shade of orange underneath that, and this is the so-called callus tissue that I have removed. And each piece, I mean, they're really translucent and easy to see through. So next I'll move onto the procedure of cross hatching, and for that procedure I'll be using number 15 scalpel, and I actually tried to dye this side of the orange so that the deeper cut can be recognized, but it's not seeping through. So anyhow, I'm just gonna go ahead with it. So as instructed by Dr. Palmer, holding it as in the signing motion, holding it at my first web with my index finger and middle finger supporting it clearly. And again, my forearm is supported very well on the table, so that motion just comes from my fingers and wrist. And I'll try not to use the sharp point of the scalpel. Okay, so this is vertical. This is horizontal. I'm not sure you can see those, but I've not applied too much pressure so that it doesn't go beneath the skin. I actually attempted this on the other portion of the orange, and as it's seen, if I compare this to, this went a little bit deeper than what I would have liked, compared to this one, which is really superficial. And according to me, this is better cross hatching than this one. So, and yeah, on this side I also practiced scraping, and as you can see, there were one or two strokes where I went deeper, so you can see the wider skin layer compared to the lighter orange on the peripheral. So now moving next to the wound debridement part. As I started, I mean, I dyed this part, and I'm going to consider this as a muscle portion. So in order to do that, I'm going to be using scissor and tweezer, and my right hand is my dominant hand, so I'll be using the ring finger and my thumb with my index finger resting on the shaft or at the junction, so that I have a good control over the cutting portion. And I actually tried the different grips, and for me the Palmer grip works the best. I tried with the tweezer resting on the first web, but I'm not too comfortable that way. So the Palmer holding is the best way for me to do that. And I'll try to do it without any support, but if I need, I mean, I'll just add the extra support so it doesn't move. So to start with, I'll be picking the part, the blue necrotic part, and make sure that I'm cutting it with not the tip of the scissor, but inner 2/3 so that I have better control and better cut at it. Again, lifting. I'm making sure that I don't pull on the tissue because that may be very painful for the patient who is already in a lot of pain because of the wound. So trying to make sure that I don't scrape the Caesar against the wound and just lift it gently with my tweezer. So again, in the whole procedure, I'm very comfortable. I'll make sure the patient is comfortable, and we'll just continue this process. All right. So at this moment, I'm just gonna pause the video and we'll give the end product. Thank you. So I have completed this sharp debridement. I've tried to clear as much as I can from the main wound. And in the process, there were 2 or 3, there's a necrotic tissue that I was able to remove. There were 2 or 3 pieces which I went deeper than what I would have liked, like this one that I actually debrided a little bit of healthy tissue, and I guess there's the other one which went a little bit deeper. I think it's curled up now. So I'll say that as I'll keep practicing, it will get better. This was a good experience for me, and I would really like that one day I'll do the actual real sharp debridement on my patients to help them heal from that wound. Thank you so much, Dr. Palmer, and have a good day.